Cultural competence in dental care. The concept of cultural competence in dental care is to understand and respect diverse cultural backgrounds. It ensures equal, non discriminatory care for all patients. Cultural identity includes race, ethnicity, gender, religion, etc. It influences patient needs and help seeking behavior. And dental professionals must combine clinical skills with cross cultural communication, empathy, inclusive mindset. The learning objectives of this presentation is to define the key concepts of diversity, equity, and multicultural competence in dental care, to describe how cultural values and beliefs influence treatment acceptance and patient decision making, identify common challenges and behavioral patterns among diverse populations that affect oral health care delivery, apply strategies to enhance cultural competence in dental treatment planning and clinical interactions, implement culturally appropriate approaches in oral health education and communication, and explain how improving cultural competence can help reduce oral health disparities and promote health equity. Foundations of diversity and multicultural competence. Diversity is a broad term referring to individuals from various backgrounds such as cultural, ethnic, racial, religious, socioeconomic, and gender and age. Multicultural competence in the dental profession refers to the ability to understand, communicate, and effectively interact with patients from different cultures. Understanding diverse patient backgrounds enhances communication, improves patient trust and compliance, and reduces health disparities and provides personalized care. The impact of diversity on treatment acceptance. Cultural factors that may influence a patient's acceptance of dental treatment may include health beliefs and practices. Cultural backgrounds influence an individual's perceptions of health and illness. Some cultures prefer traditional remedies over conventional treatments and may hesitate to accept some dental treatments. Communication styles. Nonverbal cues like eye contact and personal space may vary among cultures. Misinterpretations can lead to discomfort or mistrust between patients and providers. For instance, in some Asian American cultures, direct eye contact is considered disrespectful, whereas a lack of eye contact is a sign of respect. Language barriers. Limited proficiency in speaking or comprehending the same language as your patient can hinder the patient's understanding of diagnosis and treatment plans. Some common challenges experienced by diverse patients in assessing and accepting dental care may include access to care. So demographic disparities limit access to dental services, which affects the minority communities. Financial limitations. The lack of dental insurance and high out-of-pocket costs for dental treatment may discourage lower income patients from seeking care. Discrimination and bias. Experiencing discrimination in a healthcare setting can lead to hesitation in seeking care and mistrust in providers. Low health literacy. A lack of culturally appropriate educational material can impact a patient's understanding of oral health, which affects their engagement in treatment compliance. Challenges and behaviors for diverse populations. Diverse populations may require a different behavioral approach and have boundaries clinicians must consider when providing care. For instance, respect cultural beliefs. Different groups have varying beliefs about oral health, so clinicians should acknowledge these beliefs and include them in treatment discussions. Communication styles. Some cultures, like Chinese and Filipino, see direct questions and assertiveness as disrespectful. Attitudes toward treatment. Cultures prioritize dental health differently. For example, some may think baby teeth are unimportant and disregard recommended treatment. Family decision making. In Hispanic and Asian cultures, families often make health decisions together, so it's important to involve family members in treatment discussions when necessary. Socioeconomic barriers. Many minority groups face financial challenges that limit their access to dental care. When suggesting treatments, consider cost, insurance coverage, and time constraints. Individual approach. Clinicians should treat each patient individually and avoid relying on stereotypes about race and ethnicity. For example, the views of Puerto Ricans about oral health may differ from those of Mexican American descent. In a recent article titled Oral Health Related Cultural Beliefs for 4 Racial Ethnic Groups, pointed out some challenges dental clinicians may face with diverse populations. For instance, in this particular article, it talks about the Chinese belief in traditional Chinese medicine, or TCM. TCM focuses on the connection between the universe and the human body, promoting a holistic approach to health that includes balancing the yin and the yang in everyday life. The meridian theory suggests that problems in one part of the body can affect other parts of the body. For example, a toothache in the upper jaw may relate to a stomach issue, while a toothache in the lower jaw could connect to a large intestine issue, as they share the same energy pathway. These beliefs can create a strong dependency on self-care and often lead to a delay in seeking care, according to the biomedical standards. Another point, this article talked about the African Americans may see dental cavities as an early sign of oral cancer. Enhancing cultural competence in the dental treatment modalities. The importance of personalized treatment plans for diverse patients. Cultural, socioeconomic, and linguistic backgrounds influence a patient's experience with healthcare. It improved compliance and better health outcomes. It builds trust and safety. Respecting the patient's beliefs and needs plays a large role in treatment acceptance. Overcoming barriers. Patients are more likely to follow through with preventative and restorative care when clinicians show consideration of fears of discrimination, economic hardships, or religious customs. Promoting equity in healthcare outcomes helps reduce health disparities by addressing systemic barriers that diverse populations face. Strategies to enhance cultural competence in the delivery of dental treatment. Integrate a skill set that incorporates cultural awareness, appreciation for differences in worldviews, and an understanding of patients' perceptions of dental-related illnesses. Intercultural communication helps with understanding the meaning of direct and indirect communication, body language, and the appropriateness of gestures. Guidelines for delivering optimal care. Cultural knowledge, which is acquiring information about the cultural characteristics of other ethnic or cultural populations. Cultural awareness is being open to different cultural attitudes. Cultural sensitivity acknowledges the difference between cultures but does not focus on those differences. Cultural competency. Acquire and institutionalize cultural knowledge. Adapt to diversity in the cultural context of communities they serve. Cultural competence in oral health education. The role of cultural competency in developing effective oral health educational plans. Cultural competence involves understanding how cultural influences health behaviors and implementing this understanding into patient education. For example, Some cultures have specific beliefs about oral health practices and may prefer traditional remedies over conventional dental treatments. Some tips for delivering culturally sensitive educational materials: assess the cultural needs, use inclusive language, translate materials appropriately, incorporate cultural practices. Reducing health disparities through cultural competence. Cultural competence in healthcare is crucial in reducing health disparities among diverse populations. It involves understanding and respecting patients' cultural backgrounds, beliefs, and practices, and enhances communication, trust, and the effectiveness of care. This approach is especially important for the underserved communities where systemic barriers often limit access to quality healthcare. A recent review of multiple studies identified effective strategies that enhance access to quality healthcare. Some of these strategies include cultural and linguistic matching. In this particular study, they found a U.S. clinic with 95% Portuguese-speaking staff presented with a 28% increase in adequate care for Portuguese-speaking patients compared to other clinics. Community health workers. In this study, they also found patients experienced reduced A1C levels when educated by community health workers. Culturally adapted educational materials. In this study, they found that 17% of participants reported an increase in motivation for diabetes care after viewing culturally tailored content. A few other strategies they included was family involvement in care, organizational adaptations, interpreter services, community health networks, organizational commitment, and training. By implementing these strategies at the individual and organizational levels, it's crucial for improving access to quality health care for the underserved communities by addressing the systemic barriers, enhancing patient engagement, and improving health outcomes. Implementing cultural competence. Some practical strategies for dental professionals to enhance cultural competence include engaging in cultural competence training, enrolling in continuing education courses focused on diversity, equity, and inclusion in oral health care. Improve your communication skills, so use simple language and avoid jargon. Learn to recognize and reduce unconscious bias. Utilize bilingual translators when necessary to facilitate accurate communication. Develop knowledge of diverse cultures. Learn about different populations, cultural values, health beliefs, and oral health practices. Subscribe to culturally relevant publications or participate in local cultural events. Build trust through inclusive practices. Ask your patients if they have cultural preferences regarding their care. Display cultural sensitivity in the office through inclusive imagery and multilingual signage. Adapt policies that promote inclusion. You can implement the CLAS, the culturally and linguistically appropriate services standards into practice. Some resources for continued learning. The National Network for Oral Health Access, the NNOHA, provides resources and support for oral health professionals, including cultural competency training materials. DentaQuest is another cultural competency training program. It provides training material that promotes quality patient care through cultural competency. Or you could always do a simple Google search for any local training in your area. Some ethical considerations in patient-centered care. So the basic principles of ethics, we've got autonomy, non-maleficence, beneficence, and justice. Ethical considerations play an important role in delivering care that focuses on the patient as a person rather than just the specific issue at hand. These principles guide healthcare providers in making decisions that uphold integrity and foster trust. Patient-centered care is about respecting patients' right to be fully informed about their healthcare options. It also acknowledges their autonomy in choosing whether to decline treatment or to engage in medical research voluntarily. Informed consent is a legal agreement that allows patients and healthcare providers to discuss the recommended treatment plan. The main idea behind consent is that individuals have the right to participate in decisions related to their health and medical care. It guarantees that patients or their authorized caregivers can make decisions willingly after receiving information about their treatment options, including their risks, benefits, in an easily understood way. This image depicts some current ethical challenges: informed consent, data privacy and security, equity, integrity, and clinical oversight, transparency and accountability, continuous monitoring and evaluation. Conclusion. Some key takeaways. Embracing diversity, equity, and cultural competence is essential in providing quality patient care. Cultural beliefs influence how patients perceive treatments and make decisions. Recognizing common behavioral patterns helps improve care delivery for diverse populations. Applying culturally sensitive strategy enhances patient trust and clinical outcomes. Integrating inclusive communication and education fosters meaningful engagement and improves treatment outcomes. My final thoughts. Cultural competence is imperative to reduce oral health disparities and promote health equity within multicultural populations. As the dental field evolves, we must commit to continued learning to enhance our cultural competence. Addressing the unique challenges faced by diverse populations requires thoughtful communication, informed clinical strategies, and culturally inclusive treatment planning. Dental professionals can recognize how cultural values influence treatment decisions and outcomes by understanding the core principles of diversity, equity, and multicultural competence.